Hello and welcome back to Vidyarthee. In today's video, we are going to learn about the first HPV vaccine and how it can help India beat cervical cancer. Make sure you have subscribed to our channel and press that bell icon. So let's get started. Why is it in news? The government has announced that it will roll out vaccines for the prevention of cervical cancer to girls between 9 and 14 years through schools. The National Technical Advisory Group for Immunization, that is NTAGI, had recommended the introduction of the Human Papillomavirus vaccine in the Universal Immunisation Programme, UIP. Now, UIP is the largest public health programs which offers free vaccines for at least 12 diseases and has successfully eradicated diseases like polio and maternal and neonatal tetanus. Now, why is it important to launch the HPV vaccine? The cervical cancer is preventable and curable if it is detected early and managed effectively. It is caused by the infection with the human papillomavirus, and there are vaccines to protect against the cancerous HPV. Now, more than 58% of all cases of cervical cancer and deaths globally were estimated in Asia, with India accounting for 21% of cases and 23% of deaths. Now, when will it be rolled out? The indigenous HPV vaccine called CERVAVAC is likely to be rolled out by mid-2023. The vaccine has got the approval of the Drugs Controller General of India and was cleared by the Government Advisory Panel NTAGI for use in the UIP program. A one-time catch-up vaccine will be given to 9 to 14 years old adolescent girls before it is introduced at 9 years. Now, what happens to the girls who do not go to schools? The government has clarified that girls who do not attend schools will be given vaccines by community outreach and mobile health teams. With vaccination, screening programs need to be conducted regularly to detect early signs of the disease that will allow time for treatment. Now, what are the challenges? The burden of cervical cancer remains high in Asia and Africa. The study identified substantial geographical and socio-economic inequalities in the cervical cancer globally, with the increasing rates for countries with lower levels of human development. In 2022, India ranked 132 out of 191 countries on the Human Development Index. Now, what lies ahead? Once the vaccine is launched through the UIP, which is a well-oiled network in India, it should reach the maximum number of targeted population. The surveillance systems and infrastructure used for COVID-19 vaccinations may also be customized to improve HPV vaccination, to monitor national cervical screening programs, and to improve health system capacity to deliver more efficient preventive services. Now it's time for question for the day. When was the National Technical Advisory Group for Immunization established in India? Comment down your answers and I will be announcing the names who have given the correct answer in the next video. So this was all about the human papillomavirus vaccine. Do not forget to join us on all our social media sites. We'll meet you in the next video. Till then, keep learning and stay curious.